Hey everybody, it's Stacey, jumping in with a clarification before we even get started here. This episode is all about infusion sets, the way insulin pumps connect to the body. After the episode was all set to air, I realized I used the word inset interchangeably with infusion set. Inset is actually a brand name for a product that isn't on the market anymore. Animus users know what I'm talking about. And I realize I've probably said this many times in the past. After all, we used the Animus system for more than 10 years, and some habits are hard to break. But if you're not familiar, I think it might be confusing. So please understand, when I say inset, I'm using that as a generic term for infusion set. Kind of like saying Kleenex for tissue or Xerox for making copies. Thanks so much for understanding. Here's the episode. Diabetes Connections is brought to you by Dario Health. Manage your blood glucose levels, increase your possibilities. By Gvoke HypoPen, the first pre-mixed auto-injector for very low blood sugar. And by Dexcom. Take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Simms.
This week, how much have you thought about the way your insulin pump connects to your body? Honestly, it's where a lot can go wrong. The people who make the insets know that. They have come a long way, and they're trying to make it better.
It's what some people call the Achilles heel in pump therapy. We're not very much aware of it. And our approach simply is, instead of doing product design at the drawing board, do the product design in the field. Really taking the patient in the core of our design process, really understanding behaviors, understanding what could go wrong, and then design the product accordingly.
That's Dr. Matthias Heschel, head of R&D for ConvaTec Infusion Care. He, the CEO, and the medical director sat down with me to talk about longer wear, tips for users, and what's next for this really important part of pumping. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. You know, I'm always so glad to have you here. We aim to educate and inspire about diabetes with a focus on those who use insulin. I am really excited and happy to talk to the guys from ConvaTec this week. You know, they were frank. They were really up for anything. And I have said for years that insets are the weak link in pumping. And they really opened my eyes to some of the issues and what we can do as users or, as parents of users to make things a little bit better. And of course, they're working on improvements as well. But before we jump in, a little bit of housekeeping. I want to talk about the rest of the year schedule for the podcast. There's really not that many weeks left, but with holidays and, vacations coming up, we should have Tuesday episodes, the longer format episodes. Through the rest of the year, no interruption planned there. The newscast that I've been doing, live on Wednesdays and then turning into an audio podcast that comes out on Fridays, we're probably going to skip the week of December 22nd. I reserve the right, as always, to jump in and make a liar out of myself because there's always some breaking news. The FDA likes to make decisions at the end of December. But right now, the plan is no newscast the week of December 22nd because the podcast itself would come out on Christmas Eve. I'm not sure there's a big demand for that. Another quick announcement, and I'm actually going to talk more about this after the interview, is that book number 2 is in the works. The Second World's Worst Diabetes Mom. I signed on the dotted line to deliver that next year. So we have a timetable, we have a theme, lots of stuff. I'll tell you about that again after the interview, but man, I'm really excited about it. All right, a little bit more about our guests. ConvaTec Infusion Care makes insets for both of the tubed pumps available in the U.S. They make for Tandem, they make for Medtronic. They don't make Omnipods. They also make insets for Ypsomed and other tubed pumps abroad. But if you use a tubed pump in the U.S., you use their products. In this interview, you will hear M Lindskog, President and Chief Operating Officer, Matthias Heschel, Vice President, Research and Development and Intellectual Property Rights, and Dr. Kerem Ozer, Director, Infusion Care Clinical Development. I was thrilled to talk to all of them. It's always great when a company makes their leadership that accessible. But I worry a bit about 3 voices. I mean, really, it's 4 with mine. But I do think we make it pretty clear. And there is always a transcript over at diabetes-connections.com at the episode homepage. If you find it easier to, some people follow along, reading as they listen. Some people prefer to read. My transcription software, let me tell you, got to work out on this one. It doesn't speak diabetes very well to begin with. And as you can imagine, there was a lot of technical stuff. But we did it, we got it, and it's there for you. But I think that these three were very frank and gave us a lot of information. And as you'll hear, they have a question for us. That's coming right up. But first, Diabetes Connections is brought to you by Dario Health. Bottom line, you need a plan of action with diabetes. And we've been lucky that Benny's Endo has helped us with that and that he understands the plan has to change as Benny gets older. You want that kind of support, so take your diabetes management to the next level with Dario Health. Their published studies demonstrate high-impact results for active users, like improved in-range percentage within 3 months, reduction of A1C within 3 months, and a 58% decrease in occurrences of severe hyperglycemic events. Try Dario's Diabetes Success Plan and make a difference in your diabetes management. Go to mydario.com/diabetes-connections for more proven results and for information about the plan. John, Matthias, and Kerem, thank you so much for joining me. We have a lot to talk about, and I feel like I have every bit of the company at my disposal. Thank you so much for taking the time to do this.
Thank you, Stacey. This is John, and thanks for having this opportunity to talk with you. Maybe just a couple of words of ConvaTec Infusion Care. I'm the president and CEO of that part of ConvaTec. We are based out of Denmark and out of Mexico. We have one plant making infusion sets in Denmark, and we have two plants almost side to side in Mexico that also is fully dedicated to making infusion sets for subcutaneous infusion. Today with me, I have Matthias and I have Kerem and Matthias. If you just kind of introduce yourselves briefly.
Yeah, hello everybody. This is Matthias Heschel. I'm heading research and development in ConvaTec Infusion Care. I've been with the company for 10 years and just happy to be here.
Hi everyone, I'm Kerem Ozer, and I'm the medical director for ConvaTec Infusion Care. I'm an endocrinologist by background. I've been with ConvaTec for about 4 months now, and prior to that I was in practice seeing endocrinology and diabetes patients for about 15 years. And very excited to be here.
Wonderful. Well, thank you all so much for joining me. We have a lot of questions from my listeners, questions that I have as a mom of a kid who has used insets since he was 2 years old. So let me jump in and ask about the newest infusion set as I see it, which is with Medtronic. And Matthias, let me ask you about this if I could. We're hearing really interesting things. 7-day, up to 7-day wear, which I believe rolled out in Europe first, is now approved in the United States. I don't want to ask you to give any trade secrets away, but how do you get it to last so long when we've been told for years that 2 to 3 days is the maximum for an infusion set?
Yeah, actually, the answer is very simple, Stacey. And I think Medtronic, they provided quite some details about a year back at the virtual conference. So Medtronic, they added a proprietary connector, which connects the tubing to the pump reservoir. And this connector stabilizes the insulin. On top of that, there comes a new tubing which maintains the preservatives, maintains the antimicrobial effect of the preservatives. And last thing is that we added a new adhesive to keep the infusion set on the body for up to 7 days. So basically 3 things, new connector stabilizing the insulin formulation, new tubing maintaining preservatives, and a new adhesive.
So it was kind of a partnership with Medtronic. It's not all on the inset itself.
It's a partnership with Medtronic, and in general, talking about new product development, future products, it's all at system level. So we cannot just develop a new infusion set. We need to take the reservoir into account. We need to take algorithms into account. So it's always a close partnership with the pump manufacturers.
How have people received it? Is it working well? Is the adhesive doing okay on people's skin?
It seems so. We have received some first indication. Medtronic presented results at the diabetes technology meeting here this week, actually. And that has shown that there are lower occurrence of hyperglycemic events. There are fewer occlusions. And I think the average wear time was 7 days. So it seems that the patients that have come on to an extended wear infusion set are really happy, and the infusion sets perform as designed.
Before I move on from this, one more question for you, Matthias, if I could. I'm curious, are you working with other pump companies on longer wear infusion sets, or is this going to be a Medtronic exclusive for the foreseeable future?
Well, extending the wear time of infusion sets, that's the unmet need number one among all patients. And there's general interest from all pump manufacturers to have extended wear products in the portfolio. So yes, we're working on the portfolio of extended wear infusion sets.
Kerem, let me move over to you if I could for this question. As a parent of a child with type 1, we were schooled early on the importance of rotating sites, right? You can't let an infusion set go in the same part of the body over and over again. But most kids, and frankly, most adults I've talked to who use these products, do kind of have a favorite spot on the body. Can you talk a little bit about, yes, I guess the importance of rotating, but something like a 7-day wear or what's coming in the future? Is there a possibility that it could be a little less important to move that around? Or am I dreaming?
That's a really good question, Stacey. Sort of looking forward, just taking a quick step back, just like you said, the importance of sort of proper rotation is something we always talk about in clinic. Yet in real life, we know that people have their favorite sites. And part of the idea of the rotation, of course, is to reduce scarring and is to reduce lipohypertrophy. I know your listeners will be very familiar with this, but of course, when we say lipohypertrophy, we're talking about sort of that hardening, that bumpiness of the layer right under the skin, that subcutaneous area. And when I think about lipohypertrophy, there are several factors that increase that risk. Multiple daily injections, pumps, continuous glucose monitors, sometimes the type of insulin being used, and that really changes from person to person, reusing pen needles, all those factors. Even higher insulin doses tend to cause more of a higher risk. Higher diabetes duration is a higher risk. Now, when I think about those factors, some of them are, you can't change those, like diabetes duration. Some of those factors you can change by rotating things. When you look at something like extended wear, I think one advantage is you are going to need to change it out less often. So you're technically changing it, less often. It's probably best practice to still change the site and rotate the site. But one thing that I think that's going to be even clearer, and I see this all the time, when I talk with my patients, is I think it's going to be important to realize subtle changes in the characteristics of that site, even before you start feeling hardening of the skin, even before one starts feeling that bumpiness. If you notice that a site is starting to not respond as well, you're feeling that you're needing more insulin, you're feeling that the dynamics are changing, that's, I think, when it's going to be really key to make that site change.
Interesting. I have kind of said, and it's a little bit flippant, but I've said since we started pumping 14 and a half years ago that, gosh, these insets are the weak link in pumping. And what I mean by that is they can fall off easier. They can get occluded. They only last a couple of days. John, maybe let me ask you, can you talk us through a little bit about how you're really trying to make these better? Because I feel like I can have the greatest algorithm in the world on my pump, and if the darn thing is flapping on off my kid's stomach, it's not going to work. Right back to our conversation. Yeah, he does answer that question. But first, Diabetes Connections is brought to you by Gvoke HypoPen. And low blood sugar feels horrible. You can get shaky and sweaty or even feel like you're going to pass out. There are a lot of symptoms, and they can be different for everyone. I'm so glad we have a different option to treat very low blood sugar, Gvoke HypoPen. It is the first auto-injector to treat very low blood sugar. Gvoke HypoPen is pre-mixed and ready to go with no visible needle. Before Gvoke, people needed to go through a lot of steps to get glucagon treatments ready to be used. This made emergency situations even more challenging and stressful. This is so much better, and I'm grateful we have it on hand. Find out more, go to diabetes-connections.com and click on the Gvoke logo. Gvoke shouldn't be used in patients with pheochromocytoma or insulinoma. Visit gvokeglucagon.com/risk. Now, back to John Lindskog answering my question about making the insets more foolproof.
No, I certainly understand what you're saying. I will say, and then maybe Matthias can chime in after this, that, the products like insets, they go through a quite extensive and long development program before they actually come to the market. And the products also are developed on basis on customer feedback. And since this is a medical device, it's very highly regulated in the US through the FDA requirements, and in Europe through CE, and in many other countries through local legislation. So the level of rigor and preciseness that you have to do in this work is quite extensive. For us to develop a product and mass make it in the volumes, which we're talking about in millions of units per year, does require quite a bit of development work to go there. And there is a little bit of, there's a lot of factors that play into the development, particularly the manufacturing of the infusion set. The quality has, of course, to be the highest possible within the requirements. And there's also, of course, an economical part of it, where you need the competitive cost in order to have these products on the market. So, I mean, the products that you see today is actually a combination of all the user input, and of course also about, the requirements from regulatory authorities and what can be made in very high scale. We, strive to improve the products along the way. However, even what may seem as being very small and minute changes does actually require a complete change process, which is very well documented and in that sense also kind of lengthy process. And I don't know, Matthias, if you have any things to add to that.
Yeah, great question, Stacey. Yeah, what I would like to add is that we have about 1 million pump users worldwide, and there's a great variability. It's both interpatient variability and intra-patient variability. So huge differences between patients and also huge differences between the use conditions during a day for the same patient. So what we are going after in our product design is really making as robust designs as reasonably possible. And best example is the newest infusion set on the market, which is the base of the extended wear we talked about earlier. An infusion set we call Mio Advance, which virtually only has one user step. So you hit the button, the activation button, and it reduces the soft cannula, retracts the needle, and detaches the inserter all instantly. All the steps happening in a fraction of a second. And that means you basically take the patient out of the equation. The patient cannot do any mistakes during the insertion process. And there we see a huge reduction in failures on the market. So to your question, Stacey, we understand that the infusion set is the weakest link. It's what some people call the Achilles heel in pump therapy. We are very much aware of it. And our approach simply is instead of doing product design at the drawing board, do the product design in the field, really taking the patient in the core of our design process, really understanding behaviors, understanding what could go wrong, and then design the product accordingly. And we have seen the first successes and hope to see further successes.
That's a great point about the very simple insertion of the Medtronic inset. Are there any plans to simplify more brands? Because I'm thinking of the one we use for Tandem. And, by the time you open it, you peel off the sticky stuff, you cock it, you get it ready. Sometimes you're already set for error because if the paper rides up the needle, there's all sorts of different things that can happen if people either press too hard or do it at a weird angle. I know you know all this. I don't have to spell it out for you. But are there plans to simplify other insets in the way that you just described, since you've seen how successful it is?
Yeah, there are plans to incremental improvements on existing infusion sets based on the learnings we have from the field. Among others, what you touched upon, removing the paper liner from the adhesive, we can certainly redesign this to make it easier for the patient, and that's definitely on our agenda.
All right, I have a bunch of questions that I got from my listeners. They were really interested that we were talking, so let me go ahead and grab those. The first one here was really interesting to me. This listener wanted to know about the faster-acting Fiasp insulin, which seems to have a little bit of difficulty in some pumps. I was wondering if you were looking into that for different faster-acting insulins that the manufacturers are coming out with, and if you're testing those and working on ways to improve that in the insets.
Yeah, I mean, we keep a close eye on the market, and every time a new insulin is approved for pump therapy, we add this onto our list and do all the necessary drug stability testing, device stability testing, so we can put this onto our indication for the infusion sets. And then it's up to the pump manufacturer to also indicate the pump for the new insulin, and then the patient can use it. And that also applies to FIASP. So we have done all the necessary homework, and we know that at least a couple of the pump manufacturers are considering to broaden their indication, the pump indication, to also include the FIASP.
And to that, I may also add that we're also going to be looking at Lyumjev, the ultra-rapid Lispro insulin from Lilly, which, as you know, is also approved just recently for pump use. So that will also go through the same processes that Matthias mentioned, whether it's working on biocompatibility, looking at what the system does to the insulin and its excipients and what the insulin and its excipients do to the pump. So that's in the works as well.
I meant to ask earlier, I had heard about something, I don't know if this is the in-house name or something that you're using in research, called Lantern technology. Could you explain what that is, what you all are working on?
I was hoping you would ask this question. Lantern is a pretty simple feature that tries to mitigate the occlusions we sometimes see for soft cannula infusion sets when the soft cannula is bent or kinked. And the Lantern feature is actually pretty simple. So we provide the soft cannula with additional slits close to the tip of the cannula, and in case the soft cannula experiences any physical impact, is bent or even kinked, then those slits would open up and would allow the insulin to continue to flow. So it's basically a measure to mitigate the risk that a cannula or an infusion set can get occluded in the cannula.
That sounds really interesting. It sounds like, didn't BD Medical a few years ago have something that sounded at least to my ear, similar, that it had the different slits in the cannula, and it never came out? Is this similar technology?
It's, you could see it as a similar technology. It's though quite different. I mean, they provided an additional exit hole, just one hole, close to the tip of the cannula. And that actually weakened the cannula significantly. And the product was out on the market. They call it a smart flow technology. And the product was marketed by Medtronic as a ProSet, but was withdrawn from the market right after. And with our Lantern technology, putting a number of slits, we are really avoiding this issue that the cannula really occludes. Imagine if you just have one side hole and the cannula kinks or bends, and you would close up this hole. And in our case, having 4 or 6 slits, there would be always a couple of slits open and allow the insulin to flow. So it's a different technology.
Yeah, sure. And I don't know how much you can share. Which brands might get that? In other words, are you working with Medtronic on this? Are you working with Tandem on this? Is it somebody else? Should we be watching for this in a more proprietary form, or will it just kind of go in all of your insets?
Right now, we're in the process of implementing technology in our mainstream products, which are the Inset 2 products, which are available to all pump manufacturers. And then we need to see pump manufacturers will pick up on this.
Got it. Kerem, let me ask you, if I could, do you have any best practices for your patients when it comes to using the insets and infusion sets? Are there mistakes that are very common that people make? I'd love to kind of hear what you tell your own, or in the past, what you've told your own patients.
Absolutely. The key things, especially if someone is very new to living with diabetes, as you know, there's a lot of anxiety there. Everything is new. A lot of new information is coming in. At our clinic, what we always try to do is sort of taking a deep breath, letting people know that there's a lot of resources, there's a lot of support. At the risk of sort of repeating the cliche, it's not a sprint, it's a marathon, and really providing the resources. Sort of focusing that more onto the infusion set side, I think one key thing is starting, especially if someone's new to pump therapy, sitting down with them, going over the whole process, We had demo kits. Sometimes I would demonstrate sets on myself even, just to make sure that everyone's feeling comfortable, especially for our younger patients, having the parents there, and really taking the time to walk them through the process of what an ideal insertion looks like. And I think doing it in real life really helps in person, in real time, as opposed to watching a video where everything looks so perfect, right? So we definitely emphasize that, prioritize that. And then when we start thinking about using the sets, a lot of those things, using the alcohol pad and cleaning the area, a lot of things that are repeated, easy to say, hard to do every single time. But I think emphasizing the fact that the closer and closer we get to that ideal, the longer we can keep the sites healthy, the longer we can keep the process healthy is important. And as more technology comes in, as continuous glucose monitoring gets integrated, as the pumps get smarter, I think there's always the importance of that person factor and making sure that we're really addressing everyone as an individual and sort of seeing where they are and going and holding their hand and walking with them to where they need to be or where they want to be is key. And then there's, as you know, a lot of variation from person to person, and there's a lot of variation from day to day. And being aware of that, repeating that message. And sometimes you wake up and you have a perfect day, and sometimes you wake up and there's a lot of obstacles and changes. And bringing that message that, yes, diabetes is there. Yes, it brings challenges. But if we see it as part of a larger system, and if we address it as well as we can, as if we can stick with those guidelines and recommendations, and if we keep open lines of communication between the patient and the family and the clinic, things tend to fall into place. And I'm very proud to say, many patients, of course, live decades and decades of healthy lives with diabetes. And I think the key component there is keeping those lines of communication open and keeping that sort of positive attitude going.
All right, let's get back to some of the questions that my listeners had. And I thought this was a really interesting one. She asked me, when insets are designed, is any consideration given to those of us who deal with limited hand strength, or older adults with smaller hands, or even using colored tubing to increase the visibility of air bubbles, or maybe using color in the cannula so it would be easier to see if it was correctly inserted? I've got to believe that you look at this and you do research it. But Matthias, can I ask you to hop in and answer that one?
Sure. Well, every time when we design a new product, we put a lot of effort into the initial conceptual work. And that means that we propose certain designs, which we then show to the target population. And if the target indication of the product is smaller children or elderly people, those would be included in the assessment of the concept. So we're really trying to, already in the concept phase, to design the product in a way that we can make sure that it can be used by the target population. And at the same time, we are compliant with applicable standards. For example, when we have a product that requires actuation to push a button, what's the strength of a pointer finger for a small girl and elderly person. So we're really trying to incorporate this in our product design.
Another question came in. There used to be an infusion set by a different company called an Orbit. I don't recall this, but this sounds great. It rotated, so the tubing was less likely to get caught. Any plans to bring that back or something similar?
Well, Orbit is owned by another company, Ypsomed in Switzerland. And to our knowledge, the product is still on the market, so we don't have any insights in the details, but it's not one of our products.
Got it. It's probably something that's not available in the U.S. because we don't have Ypsomed here yet, but it's supposed to be coming. Okay, I have it might be a silly question, but I will ask it anyway. Well, that's not a silly question. I get it from listeners all the time. One of the first times I remember getting our box of inserters, we had the all-in-one. I always describe it looks like a little spaceship. I mean, I know you know exactly what I'm talking about. It was the Animus way back when, and now we use Tandem. It came with these little plastic pieces. And no one ever told me what they were for. And as it turns out, and we realized this after my son's inset got filled with sand at the beach and we could not reconnect, it turns out these little pieces are supposed to go in and protect the site and keep sand out. But I've heard a lot of different versions of what they are really supposed to do and when you are supposed to wear them. So my question is, when you put an inset on the body, it was explained to me like it's almost as though you've got like a vial of insulin with a little rubber on top. You can pierce it, but you can't get into it. In other words, you don't have to cover it every single time you take a shower or go in a pool because nothing is seeping through until you reconnect the needle. Is that the proper use of those inserters?
Yeah, this is John. Maybe just a quick comment to that. That is true that at the time of development there were some what we call spare caps, and the idea here was that when you disconnect the tubing from the site, it's true that it's sealed. The site is then sealed because there are septums that closes the fluid pathway. However, the idea about providing these small inserts was that you could protect kind of the surface of the septum with that in a kind of cover, so that you wouldn't have any kind of larger particles being able to come in the way, like this listener just described, being sand in front of it. So it was actually kind of a protection. However, it was not something which was necessary. It was kind of a choice you could make to add that in. So that's the reason behind that.
Perfect. There just seems to be a little bit of a misunderstanding in some parts of the community. What people think it keeps bacteria from getting in. In other words, if you swim in a lake or something like that, you should pop it in. But it really is just to keep out particles like sand.
Yeah, it's only for larger particles, and the site is perfectly sealed as it is. So it's more to kind of say, okay, I want to make sure that I don't have to clean it up afterwards and so on. So that was the rationale behind that.
I have one or two more questions kind of to wrap it up. Have I missed anything in particular that you guys wanted to make sure to bring up before I start wrapping up?
Actually, there was just one question that I think that at least I had, I would be curious to know about. In each box of the insets, there is an instructions for use, how you deploy the infuser set and what you should watch out. And, that is in some countries made in a number of different languages and so on. And I guess I'm just curious about, is that being read all the time, or is that, being kept in a place, or you simply just put it into the trash can? What's kind of, because I have an assumption, we have an assumption what happens to these, but I was just curious to know if you could share that with us.
I'm so excited that you asked that question, John. I think you know the answer. I can't imagine anyone is really reading the instructions. We all should. In fact, I'm going to take those instructions out and look through them. But it's one of those situations where my book that comes with each box is so thick and intimidating. As I'm telling you this, I'm thinking this is why I don't do it. Maybe it's just, I'll have to take a look at how long the actual instructions are. Maybe it's in several languages and that's why it's so thick. But we're so used to, and maybe we can blame the iPhone for this. We're so used to opening something up and being able to use it immediately and hoping, right, that it's very intuitive, that maybe that's why we don't read the instructions. So there's a lot of user error. And frankly, I know there's a lot of user error with insets. I've seen it in my house. I've been the user making the error. So I'll ask my listeners. I mean, I'd be happy to take a quick poll in the Diabetes Connections Facebook group. But I do recall taking a pump class, and we were there for 2 hours. I came home. A couple of days later, I had to change the inset on my 2-year-old. I had forgotten everything I had learned. And at the time, this was 2007, I found one video. I mean, think about the days of YouTube back in 2007, and it was in French to show me how to change the inset. But I did that rather than look for the instructions. So, John, what a great question. And I will get you more feedback from the community on that.
Okay, thanks a lot. Thanks a lot. I will say, though, that, it is a regulatory requirement that we put those in each box. And we would, like to move it into some kind of, YouTube media, something like that. However, the regulatory requirements are that it should always be there. So we want to see if we can move that in the regulatory requirements, so we can, save some printed matter and reduce the waste and make it easier to access.
That's a great point. That is a great point. Before I let you go, here in the United States, and I assume in many parts of the world, there's a lot of concerns about supply right now. Any issues, any concerns, anything people should be thinking about for the next couple of months?
No, we have had some issues on supplies in the beginning of the year when COVID-19 was at the highest, and we have been putting in extra capacity for making products and investing large sums of money into getting capacity brought up, and we should be out of those weeds by the end of this year, and we don't really see any issues going forward. But it may take some time to get that all through the supply chain. But I can assure you that we're doing everything which is in our power to always have the capacity to supply what the demand is.
Kerem, as we wrap this up, let me ask you this. You are new to the company, or you are the newest person here to the company. What excites you? And, you've worked with patients for a long time. You've seen how important this part of the device and system is. What excites you about this technology going forward?
This is a great question, and this is the reason I'm here. I'm in the company. I think it really goes back to that point about realizing how important looking at patients' insights, their experiences, where they are, what they need, and bring that feedback into the company to help develop new technologies. And I would say a direct corollary to why I'm so excited about my role here is this is really sort of being a medical person, a physician and endocrinologist in industry. You really play a bridge role. You're constantly talking with the engineers, with the business side, and you're keeping your ear open to your patients, your community, and your colleagues. And sort of you're part of that feedback loop, bringing back ideas, presenting, products and saying this will work, this is a great idea, and sort of keeping that momentum going. And I'm very excited about that.
Excellent. Matthias, you are in R&D. You are the head of R&D. You're in I wouldn't say the trenches so much, but you're really seeing realistically what's happening on the company every day. Anything you want to add to that? I mean, is there anything that you're really excited about that you'd like to listeners, to leave listeners with?
Yeah, I mean, what I always tell the engineers is, you guys, you are directly responsible for how patients or people with diabetes, how they feel, how they are able to manage their daily life. If we do a great job, those people can lean back once in a while and perhaps even forget about the disease. If we do not do a perfect job, they have a terrible day. So that's really what people understand, and that's why, at least how I see it. I mean, those people in the medical device industry typically work longer, work harder because they understand the responsibility they have.
Well, thank you so much, all of you, for spending so much time with me, for answering our questions, for posing your own questions, which doesn't happen that often. And I'm really glad that you did that. We will get you some answers. Thanks so much, gentlemen.
You're listening to Diabetes Connections with Stacey Simms.
Lots more information at diabetes-connections.com at the episode homepage. And I'll link to some of the studies they talked about, that longer wear, the stuff that's in the works. And let me tell you, I went and got the book. I have it right here. Can you hear that? I'm wiggling it. I went and got the book that comes with the insets. And it's right there, of course, on the top with the little horseshoe thingies that they explained. I hope that cleared up some stuff for you. The book is long because, as I said, it's in many other languages other than English. The directions are maybe 2 to 3 pages long. I think it's really just 2 pages. There's some pictures here, but the English instructions are 1, 2, 3 pages long. And then that's it. So Benny and I actually sat down and read them. And he does it slightly differently. But what he does works. I mean, we are 15 years into diabetes. So that means we are 14 and a half years into pumping. So he's got it down. But if you're having trouble, I may start a thread in the Facebook group because there's some really easy tips and techniques to make sure that you put these insets on correctly. I mean, follow the directions. That's your best bet. But as you know, the community can help too. So we'll put that in there. And of course, I'm going to put a poll up about the, I may have already done that by the time the episode airs, because a poll up about have you ever read the directions? I was a little embarrassed. You heard me laughing when he asked, but I'm glad he did. All right, I've got some news coming up about next year. And oh my gosh. But first, Diabetes Connections is brought to you by Dexcom. And when we first started with Dexcom, it was back in 2013. It was about this time of year. The Share and Follow apps were not an option. They just hadn't come out with the technology yet. So trust me when I say using Share and Follow make a big difference. I think it's important, though, to talk to the person you're following or sharing with and get comfortable with how you want everyone to use the system. Even if you're following your young child, these are great conversations to have. You know, what numbers will make you text, right? How long are you going to wait to call? That sort of thing. That way, the whole system gives everyone real peace of mind. I'll tell you what I absolutely love about Dexcom Share, and that is helping Benny with any issues using the data from the whole day and night and not just one moment. Internet connectivity is required to access separate Dexcom Follow app. To learn more, go to diabetes-connections.com and click on the Dexcom logo. A couple of weeks ago, I told you I would have some book news, and I do. I am so excited to announce that The World's Worst Diabetes Mom, Part 2, is going to be out next year. I just signed on with my publisher. We talked this week, actually this morning as I'm taping this episode, and we laid it all out because, my goodness, with some of the publishing issues, probably hopefully not the shipping issues by next year, but a lot of what's going on in the publishing industry, I have to have everything done earlier than I did last time to have the book ready by a certain time of year. I want it out for, as you can imagine, I want it out for November of next year because Diabetes Awareness Month is my best bet to get any kind of, I guess, mainstream media attention, non-diabetes media attention. And that worked really well in 2019 when I put out the first book. The name of the book is not Part 2. I'm not sure what we're going to call it yet, but I will be sharing that with you all. I'm going to be sharing more of the process this time around, just because I think it'll be fun. And I'm going to be sharing things like cover options and title options in the Facebook group, Diabetes Connections, the group. So if you'd like to help me, the community was a huge help last time around in terms of how to word things. Because, you know, when you're a parent of a child with type 1, there are some differences that you want to be respectful about. There's some differences and ways of wording things that just for clarity, right? A good example is, are you a T1D parent? To me, that means a parent who lives with type 1, right? So it's little things like that you just have to be careful about. And you all helped me so much with that the first time around. So I will be asking the second time around. I have an idea for a title. I kind of know what the direction is going to be. I know what the title is going to be. I know what the focus is going to be on. We're going to be addressing a lot of the things that I have been asked about since the first one came out. So really excited, a little bit nervous, but man, I loved writing the first one. So I hope this will be as much fun to put together. All right. Thank you so much to my editor, John Buchanan from Audio Editing Solutions. We will be back on Wednesday. We are now live on Facebook and YouTube at 4:30 Eastern time. And then around 4:45, I'm live on Instagram. A little bit different. For those of you who go live on Instagram a lot, like a vault. I mean, what a pain, right? But it's fun. I like doing it. It's only a pain because I share photos and I'm not that adept, really. I mean, Instagram is not a friendly platform for sharing photos live and reading a script. Let me just tell you. So if you've got advice on that and you know how to do it well, let me know. Or you could just listen to the audio podcast that comes out every Friday for In the News. Thank you so much for listening. I'm Stacey Simms. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.